Hi everyone, this is Adrien, the exercise specialist at the Leduc Beaumont Devon Primary Care Network. I hope you all are doing well today. It's been a little bit over a week since my last video. Sorry, I was on holidays, but I am back now. For today's video, I'm actually going to be showing some exercises for people dealing with kind of a deep kind of internal hip adductor pain or groin pain, deep hip groin pain. These exercises are often used to people that develop what's called a groin strain is the term that is often used kind of in this context, and this involves pain that's really deep on the inside of your hip of your hip musculature. So when I say hip adductor, what that means it's the muscles that make your leg go from outside back to the center of your body, so the midline. Adductor is like adding to the body. So even this, if my arm is out here and I bring my arm in here, this can also technically be a form of adduction. That plane specifically has other terms, but in essence, it's still adduction. So when you take your leg, bring your leg from out to in, that's adduction. You're adding it to the body. So people that are dealing with groin strains or deep adductor pain, things like that, bringing your leg into the midline of your body can be painful. All those muscles do a lot of different things to your body as well. They do a lot of stabilization movements for your body. So a lot of standing and swaying and things like that are actually controlled sometimes by those internal hip adductor muscles. Because you think about it, if you shift off of your midline and you start to go out, if the force is going outwards, the antagonistic muscle groups, in this case the adductors, are what actually hold you in center. So they help with a lot of balance and leg stability and things like that. And they're often a weak muscle group for people. Not often as weak as your abductors, the muscles on the outside of your hips, but they still tend to be issues as well. And I thought about doing this video as I personally developed a bit of an adductor strain a couple weeks ago, just before my vacation. So I'm dealing with a little bit of adductor pain myself. So some of the symptoms, like I said, that people can feel is pain with standing or bringing your leg out to in, or certain stabilization movements. Even sometimes taking your leg and lifting it up or bringing your knee up can sometimes bring on pain as well. So as I'm experiencing this on my right kind of deep groin adductor muscles, I will show you the exercises that I have been doing for this side just to help me with my recovery process. Once again, this is about 2 weeks old for me. So actually the first week I didn't do a whole lot of rehab on it whatsoever. I just rested it and did some light movements like light walking, light stretching, things like that, just to keep it moving so it doesn't really stiffen up. Now that I've gone to week two and things are feeling a little better, now I'm going to start hitting the rehab part of it to make sure things are good and strong, get blood into the area, keep things nice and functional. Because the last thing we want to have happen after an injury heals is have it be weak and unfunctional or dysfunctional, because then that can cause a whole bunch of other issues and likely lead to re-injury. So you want to come out of an injury with that affected location as strong as possible. If possible, as strong as before, if not more so. It can be difficult to come out with a stronger kind of area that is affected than before the injury, but as close to normal as you can, and if you can make it a little stronger by the time that the pain goes away, fantastic. So what I'll do is I'll show 5 total movements today that I've been doing. 2 are stretches, and then 3 are actual exercises. So what we'll do is we'll start off with a stretch, and then we'll do the 3 kind of strengthening exercises for lack of a better term, and we'll finish off with one final stretch. So just to wrap all of that up, you should not necessarily use these exercises to diagnose yourself with a hip adductor strain or with a deep groin strain or anything like that. Always go see your physician or your physical therapist or your exercise physiologist or your kinesiologist, someone like that, to discuss these first, to get properly assessed and properly diagnosed. But these are often exercises that can be used in this kind of situation. So, just for the same old waiver here, if you're new to physical activity, if you're returning to physical activity from a long layoff, or if then please speak with your physician prior to beginning any new exercise program. Thank you. So we will begin with the next exercise, So not only if you're new to physical activity or if you're returning to a long way off, but also if you have any medical condition that might make doing physical activity difficult, please consult with your physician prior to getting any new exercise program. Thank you. So the first movement we'll be starting off is with a stretch. So the first basic stretch that we'll do it in two separate ways. So we'll do the butterfly stretch first. So my feet are together, as you can see. Once again, my right side is the affected side here. So I'll be focusing a little more on that side today. This one, we're gonna clasp our hands under our feet if we can. Try to bring our feet as close to our body as we can. Try to get our heels close. And we're just gonna stretch our legs out to the side. We'll hold that for a little bit here. Make it a little harder. You can press down on your knees here. Try and spread your legs out. Get a good deep stretch in there. Awesome. The final version of the stretch, I lay back, and then what I'll do is I'll go legs out to the side. Sometimes laying down like this is a bit of an easier way to actually access your adductor muscles and your deep groin muscles. Here. Sometimes as one of the movements, since my right side is the issue, what I'll do is I'll bring my left leg up, and also like this, and let's work on bringing my right leg back up and in. Right leg up and in. Just to get more movement. You see this movement of bringing it up. So that movement is where the issue lies, and those are the muscles that are affected. There we go, up and in. You can make it harder by bringing out your leg, doing the same thing. See, that is still difficult for me, that causes a bit of pain. So I will stick with this one to strengthen the area. Awesome. So that is the first stretch. So now we'll move on to the three primary strengthening movements of the day. So the first movement is actually going to be a basic side plank, which I've shown lots of times in lots of videos. There'll be a side plank from your elbow. When you're in a side plank, you're actually using a lot of your adductor muscles, so in your hip, and a lot of your intercostal muscles, some muscles on the side of your core to help stabilize. But as you see, when I go up into this position, my top foot here presses down on my bottom foot. When it presses down, my deep groin muscles, my adductor muscles, have to help stabilize. So it's a great way to get some blood flowing and some muscle stimulation without having to move the area too much here. So we will come here, up on our side, and we'll hold that. So you can feel that deep in that hip. So I'm trying to make a straight line, head to my toes. Hold that for about 5 more seconds. Awesome. Now usually I would do that for 3, 4, 5 rounds depending on how I'm feeling during the day. This next exercise is a cool one. So this one I'm laying down on this side. My left leg, so my non-affected leg, is supporting me on the ground. And what I'm going to do is I'm going to take my right leg, and my goal is to bring it up as high as I can here in front of my leg. Some people do it behind. I find it easier doing it in front personally, probably just to how I'm built. Okay, so you go right on your side, leg up, and you bring versus just bringing your leg straight out and up. So my back of my right knee is almost rubbing against my left calf. Going up, hold, and down. Up, hold, and down. So this specifically focuses on those internal adductor muscles and those deep groin muscles in your internal hip here. Up and down. So this has probably been my most beneficial exercise so far here. I found this exercise to be super helpful. If this is too difficult, you can bend your leg more, bring it in, and then eventually you can work towards straight out holds. You can do this for 5-second holds or so, and bring it down, up and down. The goal should be to bring it up as high as you can without losing your form or being in, any, substantial amount of pain. So that's probably been my most beneficial exercise so far. That's another one you could do for, you do sets of 10, sets of 20. Do a few sets a couple times a day. You're getting a lot of work in on those hips. So the final exercise that I found to be really helpful here is some banded adducting work. So see, I have a band here that I have attached over to a piece of gym equipment over here, so it shouldn't come flying. Hopefully, if it does, it'll be good for the video anyway. So as you see, I have a band attached to my ankle and to the machine. So this is the band is pulling me that way. Since this hip is the issue, and the internal hip muscles and the adductor is where the pain is, moving it this way causes the pain. So moving against the resistance is what causes the pain with the movement, which is exactly what we want. So I come over here towards a good amount of resistance, I let my leg go out, which is good, and I bring it in, and if I can cross parallel, fantastic, but you don't need to, and out, in, and out. And obviously, the more I stretch the band, the more difficult the movement is, in, and out. Once again, moving my leg inwards is where the pain is and where the affected muscles have to work. So I experience no pain out here, very closer. Once I cross or close midline, it starts to get kind of tight in there. This is another fantastic movement for someone like me, or sometimes some people dealing with some hip adductor or groin strain should do. It's very low impact, and it's great strengthening. Eventually, I would get people to hold, for 4 or 5 seconds if you can. Right? You hold it there, and then back, and back. And I'm someone personally who I do this for about sets of 20 or so at a time. And there the band goes. Perfect timing. So see the band shut off. We didn't need it. We didn't need the band anywhere anyway. So now we'll go on to the final stretch as Coach Luna comes to check, make sure I'm okay. I'm okay, girl. It's all good. She always wants to make sure I'm safe and okay. So for the final movement of the day, we'll finish off with one more stretch for the hip. And this stretch can be done from your knees or from your feet, depending. On your feet, you'll get a bit of a better stretch, but you can do it from your knees to start as well. So I'll just show you guys. So we're gonna get up onto our knees here. Watch out, sweetie. Watch out, girl. Watch out. So there you go. Now she is gonna watch from nice and close. So you're gonna be standing up here, and you'll see. So obviously I'm on my knees. I got a slightly wider than shoulder width stance on my hips. Slightly wider. Not crazy wide, just slightly wider. So now what we're gonna do, you're gonna put your hands on your hips. I find this easier. And then what we're gonna do is we're gonna shift our hips out. So since this is the affected side, I wanna shift this way to help stretch those muscles in there. So I'm simply just kicking my hips out to the side. And we're gonna push, 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 and then back to normal. You can do it to both sides if you want to. Push, 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 and up. Push, push, push. Push, push, push. I mean, a really good stretch in those internal thigh or quadricep muscles. Perfect. Now, just to show the standing version quickly, we come here, same kind of thing, hands on your hips, slightly wider than shoulder width stance, legs straight. I'm going to shift my hips to the left to get a really good stretch on those internal quadricep muscles, all the sartorius muscles and the adductor muscles there. I'm going to shift, you bend this knee to help you get deeper. This is a much better stretch. And do the same thing on the other side, shift, shift, shift. So you going this way, I have zero pain, zero restrictions. As I go this way, it starts to get quite tight, and I feel that restrictions come to play. I'll wait to make sure the stretch is better. Try to stay as upright as possible. If you roll forward, it kind of releases it a bit. So stay up nice and high, hold it, push. See, I'm pushing into my hip as I shift. Fantastic, that feels really good. So, that's one you could do for, sets of 20 or 30 seconds at a time if you want to, or do 5 seconds or so aside, kind of pulsing as I tend to do. And you can do that for 3, 4, 5 times a day if you want to. Just try and keep it loose. If the pain starts to get really sharp, then that's where you kind of wanna stop before you feel that pain getting too sharp. It's always good to exercise up to where you know that you're like, okay, I can tell the pain is gonna start to creep in. It's okay to exercise when you're uncomfortable. You should not exercise really if you're in significant amounts of pain. It's counterintuitive at that point. More times than not. There are situations where it could be of a benefit, but a situation like this, you can exercise when you're uncomfortable, but if you reach levels of legitimate pain, that's not the thing that you want to work through. So, I hope you guys found that helpful. If you have any questions, post them down below. Please subscribe to the YouTube channel and like the video. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much, and have a great day.